who do we have here? Hey, how are you doing today? Good. Then why'd you come in? No, I'm just playing. So, we're gonna do a few different things just to test your mind, okay? So, what we're doing here is called a cranial nerve exam. And basically, I'm testing like your senses and stuff. So, we're gonna be testing your eyes, we're gonna be testing your field of vision, your depth, front, back. We're going to be testing your sense of smell. We're going to be testing your sense of taste. So before we get started, I got my little notepad here. Can I get your first and last name? And how did you spell that last name? Alright. What is your date of birth? Alright. Awesome. My best friend has the same birthday. Different year, but same day. So that's really cool. And your phone number. Alright. So, no, trust me, I'm not gonna call, it's not for a date. I'm professional. So, we're gonna start here with a little thing I like to call, I like to make eye contact when I'm talking, so we're gonna be doing a little following the light. Yeah, so let's just get right into it. Alright, so behind my fingers here, I've got a light. And basically all I want you to do is follow it, So it's gonna go like something like that. And just do your best, you can move your head, move your eyes, whatever you'd like for this test. And we will begin. So just follow the light. Yep, like that. Yep, you're doing great. Yeah. Alright, awesome. Everything appears to be looking good. Let's go across the top here. Do a bit of circle action. And we're going to get closer and then further. Alright, your pupils dilated, so that's a great thing. So, we're going to now do another test. But this time I want you to follow my finger. So you're going to follow my fingers like this. And once they leave your field of view like there, can you see them anymore? Yep. So you're going to follow my fingers until you can't see them anymore. And once you can't see them, just let me know. And, this is just a test. There's no good or bad. There's no scores, so don't worry. You've been doing great so far. Just keep it up. So, alright. Can't see. Great. Awesome. Yep. Almost. Yep, now. Alright. Can't see. Alright. Great. Awesome. And let's do some. Alright. Alright, good. Alright, you're doing great. So we're going to move on to we're going to test your sense of smell now. And I'm going to give you this first object. And just give that a smell. Alright, and what did you smell? Great, yeah. It is citrus, yes. So, let's get you to try another one. this one's a little harder, you know, because usually when something's orange like that, it is citrus. So this one, there's not as much, but go ahead and smell. You smell apples? Are you sure? Yeah, you're right. No, I'm just messing with you. You got it. This one's going to be a lot stronger, so are you ready? Alright, great. You're doing great, by the way. Alright. Smell? You can smell back here, yep. Yep, cinnamon. Right. Alright, amazing. You seem to be in very good order. So, next we're going to move over to a taste test. Now, basically, you don't have any like allergies, like food allergies I should know about, correct? Alright, so we're going to just go ahead and test some products on you. And you just let us know the flavor. Alright? Great. Yeah. Alright, so do me a favor and close your eyes real quick. Alright, and stick your tongue out. Great. Yeah. And give a dab of that. And what did you taste? Chocolate, right? Right. So, I'm just gonna set this on this little table and move on to the next item. So, this time, much different of a taste, and this one's definitely going to test it, but it does have a pretty potent taste, so you should be able to get it right off the bat, as long as you know what this tastes like, obviously. So, close your eyes for me again. Great, yep. And tell me what you tasted. Right, it's strawberry. You're doing great, yeah. So far I haven't seen any reason to doubt that you're capable with, your cranium, But let's just do one more taste test and then we'll just do a few more tests. And, I mean, you've already aced most of them, so I would imagine you're going to ace the rest. So let's just finish up and everything will be good to go. Alright. So, I want you to close your eyes. Alright. And taste. Awesome, yeah. Peanut butter. Yeah, now you know why I had to ask that question of if you were allergic to anything. A large percentage of the population is allergic to peanuts. I think the statistic's over like 15% now of just people in the United States, so it's definitely a large number. But let's move on from taste. I'm sure you want to do it a few more times, but we gotta move on. We're gonna do a depth test. Sorry about that. Man, you would think I'm drinking. Trust me, I'm not. But we're gonna do a depth test. So, like I said, like something like that. So let's get right into it. All right. So what I want you to do is I'm gonna hold up two fingers. One of them I will move closer, and one further. Or I can move them both backwards. But you still need to tell me which one is closer to you. Alright, so let's get started. This one. Yep. Yep. The same? Alright. This one? Yep. This one again? Yep, correct. This one? Yep. Yep, this one just by a little bit, just by a little bit. Alright, so I'm just going to write a few of these things down, you know. I'm just going to throw some A pluses on here, you know. You've definitely passed the follow the light. Yep. Actually, now that I think about it, we're going to do the depth test again. But this time, I'm going to actually cover one of your eyes. Is that alright? Alright, and I'm just going to follow the look in your eye to kind of see how it adjusts. Alright, so let's get started. Alright, starting close, getting further. Alright, looking good. Looking good. Starting close. Alright. Starting far back and coming close. Right. And starting close and coming back. Great, yeah. You're doing amazing. No, don't worry, you're doing great. But I believe, you know what? I do have one more test. So we're going to do a hearing test. And basically what that is I'm going to whisper like really softly in your ear, and I just want you to repeat the letters that I'm saying in your ear. Alright? Great. P-L-T. P-L-T? Yeah. No, like B was close, but it was actually a P. I know they sound really similar, so don't worry. That was kind of like a trick letter. And I said the LT, so, you know, the mind's just going to go to B. So we're going to go a little easier, you know. We started at the hardest thing we could start at. So there's nowhere to go but up from here. T-I-C. T-I-C? Great. Great. Yeah. X-Y-Z. Yep. So, sounds like your hearing is good. We should try. I'm gonna do a few number combinations, and then, you know, you'll be ready to go, you know. Alright, so 716. 716? Correct. Great. Yep. 823. 823. Yep. Amazing. Yep. 1, 2, 3. 1, 2, 3. Yep. Yeah, that one was a little quieter, but no big deal. You heard it. You're doing amazing. And actually, we're all done here. So you did great. And I just want to thank you for being an amazing patient. And I hope to see you again soon, you know. Cranial nerve exams are a lot of fun to give, you know, a lot more fun than the physicals. Alright. I'm going to tell the nurse to put this in the system and you'll be good to go. Thanks for stopping by.